Very good evening, ladies and gentlemen. You have a little bit of aware that the last 5 to 6 or more than 7 probably, we have been doing a program on cancer. Basically, we have started from women cancer. So firstly, we have chosen breast cancer. As everybody knows that the occurrence of breast cancer is to some extent second highest among the women fraternity throughout the world. India is not an exception. So many women have been suffering from breast cancer, that is hormone positive. We have earlier discussed it. And hormone positive is a very hopeful cancer. Always Dr. Tanmoy Mandal is with me, the medical oncologist of one of the biggest multi-speciality hospital in Calcutta. He was earlier attached to some big hospitals. Now he is being attached to the biggest corporate multi-speciality hospital in India. Plenty of patients every day coming, and literally Tanmoy is frantically busy. Not a single day I have got him in my studio in proper time, as because he is so patient friendly. At the last moment when I am ringing repeatedly, he just told me, just wait 5 minutes. I am just coming out from my chamber. This is the last patient. Such a pro-patient doctor, literally, I have rarely seen earlier. So, any day, probably 8 to 9 programs we have telecast. Not a single day I have got in my studio Tanmoy in perfect time. But today we have decided, so many people and so many women, they have repeatedly requested us to make a program on English, as because they are mostly more frequent in Hindi or English. And Tanmoy has also told that it will be better for him to tell specifically the terminologies in English, as because we are more frequent, we are more being habituated to speak in English, as because the tongue twister terminologies, it's very difficult to translate properly in Bengali. So today's subject is breast cancer. From the very beginning, we would like to cater hopes among the women fraternity. And Dr. Tanmoy Mandal assured that 55 to 60% of women cancer fall in the category of hormone positive. That is to some extent safe. And he again assured, only condition is there, you will have to come earlier, as early possible. Whenever you started self-breast examination at the age of 13 or 14 or maybe 15th, from that particular age you should have to be cautious about your superficial organ breast. And it's very easy. If you feel any abnormalities, any lumps in your breast or armpits, you should have to be cautious. The rest, Tanmoy will tell. I am just giving the camera to Tanmoy. Tanmoy, let's start.
So, good evening everyone. So today it's on breast cancer, the most common cancer in females in India. And if you ask the risk factors for breast cancer, first we should come to the risk factors. The risk factors which are associated with breast cancer, one of them is the genetic factors. Genetic factor, mostly the genes. what are the genes which mediates breast cancer? The BRCA1 and the BRCA2 are the most common genes. But a point to remember is that overall out of 100 patients of breast cancer, only 15 to 20% of the breast cancers are due to genetic reasons. So what happens to the remaining 80-85% of the patients? Most common cause of them is idiopathic. That means mostly the cause is not known to us. We have some other causes also, like smoking, like alcohol, estrogen mediated, some other reasons also. So they are also associated, but it's mostly idiopathic, which is the most common cause of breast cancer. So next, coming to the symptoms, that when should a female be aware of the breast symptoms? First and foremost point to make is that 80% of the breast lumps are not malignant.
That are benign.
They are benign. So if you feel a lump in the breast, don't be afraid. That's the most important thing. Don't be afraid.
Paranoid. Don't get worried. As because Dr. Tanmoy Mandal is assuring you that mostly are benign. If you just feel a lump or anything else like that, but only in case of lumps, Tanmoy. Otherwise, if there is inverted nipples or any discharges,
those are different.
Those are different.
Only if you feel a lump in your breast, don't get afraid, because most of the breast lumps are benign. Most means it's most. So
and most of the times, basically the patients represent with breast lump.
Lump only. The most common symptoms with which a female presents with breast-related symptoms are breast lump, pain in the breast, a feeling of lumpiness in the breast. These are the common symptoms which a patient or a female presents with breast-related symptoms. In majority of the times, these are non-cancerous. So, if a patient has any of these symptoms, don't be afraid. It's mostly not a malignancy in those cases.
Basically, the female or male patients, whenever they suspect something, they are getting paranoid. That is not the issue. Don't get paranoid. There is lots of hope. If the worst possible thing is that the person may have been affected or infected by cancer, any kinds of. Mostly you like doctor are treating them in such a way that there is a chance of getting cured very soon. No. So we are spreading the hope among the fraternity of the community. Cancer does not mean end of life. Even Tanmoy told that it is the beginning of life. It's a second life.
So next comes the symptoms. With what symptoms does a female or a male of breast cancer present to us?
Mostly we are concerning our treatment modalities in females.
Females. So
basically males breast cancer
is very rare. It's very rare. So we will be
we'll emphasize our discussion
on the female breast cancer. So the most common symptom is a lump in the breast. So breast being a superficial organ, it's easily palpable, it's easily felt, perceivable. So any female who feels a lump in the breast, she should report to her doctor immediately. That's one thing. What are the other symptoms of these breast malignancies? So there might be, first comes the nipple complex. So nipple areola complex, there might be discharge from the nipple, which can be a bloody discharge, it can be a serous discharge. One point. Next is there
discharge, that is serous
discharge. So there can be inversion of the nipple, means the nipple may go inside, inverted, retraction or inversion of the nipple. That is the second thing. Third is that the lump, we need to see the size of the lump. As per with the measuring tape, we need to measure what is the size of the lump. Next, we need to see whether the overlying skin is involved, whether the overlying lymphatics are involved, whether the underlying structures like the muscles are involved, whether the tumor is involved to the chest wall. So what happens is that if a lump is present and if it is not mobile side to side or up or down, anything, that means it is fixed to the chest wall, it is fixed to the deeper muscles. So that's one point which we need to see. If the overlying skin is red and if there is appearance like a pewdy orange, means the appearance is like the orange peel, the peel of an orange. If that such a feeling, dimpling is noted in that area, that is known as pewdy orange. So that means the subdermal lymphatics are involved in that location. So breast, we divide the breast into 4 locations. It's the upper inner quadrant, the upper outer quadrant, the lower inner quadrant, and the lower outer quadrant. So these are the 4 quadrants in which we divide. So that is one thing. Next, these are the common symptoms.
And suppose, Tanmoy, if anybody finds a lump at the age of 13 or 14, should she visit to you?
So preferably, see, if any lump of the breast, any female has a lump in the breast, the
At
first,
an early age.
even at an early age, it's mostly the pediatrician which they visit. That's common. Next, they visit to a gynecologist. That's also very common, which we see. And the third person which they visit is a surgeon. So the best person whom I feel that they should visit is a surgeon, because surgeon is the right person to see that what type of lump is it. Is it a lipoma? That means a fat in the breast.
Fat deposition.
Is it a fibroadenoma? Is it a fibrocystic disease, or is it a malignancy? So these are the most common 4 differential diagnoses which we have of a breast lump. So next comes the symptoms which I said regarding this breast. The other symptoms are first regarding the axilla or the underarms. There might be glands or nodes noted within the axilla. That's the next thing. What are the other symptoms which we have, which means that the disease has spread to the other parts of the body? There might be, if the patient disease has spread to the brain, there might be headache, there might be vomiting, there might be seizures. That's one thing. Next, if it has spread to the lungs, there might be cough, there might be breathlessness, there might be heaviness in the chest pain. If it has spread to the bones, it is associated with mostly bone pain. It might be pain in the back, it might be pain in the low back,
myalgia,
anything, bone pain. Next, if it is spreading to the liver, there might be jaundice. If it spreads to the abdomen and has ascites, that means fluid in the abdomen, the patient is abdomen is tense and distended. They feel that early satiety or a feeling of bloating sensation also happens within the females. So these are the common symptoms which a patient of breast cancer presents
that
to
can be
us.
easily perceived by the woman.
Yes,
As because
these are
it's to some extent something unnatural,
yes,
abnormal.
yes. So these are the common symptoms which breast cancer presents to
And
us.
if they take profuse of H2 inhibitor or
Rentec and Pan40.
kinds of these kinds of medicine basically, and domperidone and the other things, the symptoms will not get resolved.
So these happens is that when the patient feels that she has a bloating sensation and she takes some pantoprazole or esomeprazole type of drugs, feeling that this bloating sensation will go off, generally they don't go off, because this bloating is not due to gastritis, it's mostly due to the ascitic fluid which compresses the gut. And
2 to 3 months they are continuously taking these kinds of medicines, H2 blockade or the pantoprazole groups of medicines, but
with no relief.
Definitely there is no relief
From the
then
symptom.
you must have to be cautious that there is something abnormal, unnatural, and it is due to cancer. Maybe there is a chance. That time you should and must visit to a medical oncologist like Dr. Tanmoy Mandal. He will decide the rest of the things which will be better for you.
So next comes the diagnosis part. So how a diagnosis of breast cancer is done? The most and the only most test is the biopsy from the breast lump. That's the most important test. This is the test for diagnosing.
The one and only test.
The one and only test. That is the test to diagnose what is the type of cancer. Is it a ductal cancer or is it a lobular cancer? That's thing. Next is to see the immunohistochemistry. That means we need to see the hormone profile.
Tanmoy, just I can remember, John Hopkins or NIHs, the TIL divided cancer in this way: ductal cancer, invasive lobular cancer. In this way, they have categorized in 4 the cancer till today, and that is the protocol.
Yes.
NIHs and John Hopkins University, both of
So
them.
generally we divide this breast cancer into these 2 types. It's ductal cancer and it's lobular cancer. Some other types like the papillary carcinoma, the cribriform pattern, the metaplastic types, these are also
There are
some
so
of the
many.
other types, but they are rarer types. But
That
the
is to
most
some
common
extent
is
very technical to the common
Yes.
people also.
So the most important is the invasive ductal carcinoma, which we see. Next comes the immunohistochemistry, where we see 3 markers.
And there will be a question that you have told that 55 to 60%
Yes, I will.
hormone positive, and that is ductal carcinoma.
Yes, these are mostly ductal carcinoma. So ductal carcinoma is the most common type of all the types of breast cancer. Next, even if whether it's a ductal carcinoma or whether it's a lobular carcinoma, what we need to see is the immunohistochemistry pattern. That means we need to see the estrogen receptor status, the progesterone and the HER2 receptor along with the Ki67. So these are the 4 immunohistochemistry markers which we test. So if the patient is hormone positive, that means estrogen positive, progesterone positive, or even if it is only estrogen positive and HER2 has to be negative. So these are the subset which is known as hormone positive HER2 negative breast cancer. This is the best type of breast cancer which anyone can have. The incidence being around 55% of the patients who are having such type of breast
in your
cancer.
day-to-day practice, you are getting mostly the
And
patients
this is
on.
the most common type of breast cancer which we have. So this is a good prognosis breast cancer. This is the most common type of breast cancer, and this is the
And the treatments are very good for this. For these kinds of
the
hormone positive.
most important developments happens in this field because we want to improve the lifespan even more and more, as much as possible. So for this subset of patients, if the patient is stage 1 to 3, they will be requiring a surgery followed by chemotherapy and then a radiation along with hormone therapy. Nowadays we have the role of a special targeted therapy known as CDK4/6 inhibitors in curative patients, and in stage 4 patients who are having a hormone positive breast cancer with an HER2 negativity. So in those patients, they are mostly treated with hormone therapy along with the CDK4/6 inhibitors.
And the outcome?
The outcome, the average 5-year or the median 5-year survival of a stage 4 hormone positive breast cancer is reaching near about 5 years. Median survival. Median survival means
If a patient come to you at the age of 25, and if it is a hormone positive breast cancer, so that's a good kinds of prognosis.
So it has to be a stage wise. So if it's a stage 1, 2 and 3, they are mostly curable. So they are got
only stage 4.
4 I am
that
telling
is to some extent headache to you.
Yes. So stage 4 is only, it's the median survival is up to 5 years at least. But stage 1,
But
2
the
and 3.
chances are there probably the patients will come at later age.
Yes. So
Not
that is
very
right.
early.
So this is the best type of breast cancer which we have. The other 2 types are, one is triple negative, that means all ER/PR and HER2 are negative. So that's the worst subtype of breast cancer. Mostly it's around 15% of the breast cancers. And next is the HER2 positive type of breast cancer. They are also an aggressive type because HER2 itself is an aggressive biology in breast cancer. So that also comprises around 15% of the breast cancer.
Biology is very aggressive in case of HER2.
HER2 positive and for triple negative. So for HER2 positive, what we have is a targeted therapy in the name of trastuzumab, pertuzumab, TDM1, and now trastuzumab deruxtecan. These are the targeted agents which we have in our basket. And for a triple negative breast cancer, mostly the chemotherapy is the main target or the main line of treatment. We have the role of immunotherapy in this subset of patients. That means triple negative breast cancer has a good outcome with the use of immunotherapeutic agents.
And immunotherapy is readily available here in Calcutta.
It is readily available.
And you are regularly using that.
So we use that. So these are the three types of breast cancer which we see. Next, coming to the so diagnostic, what I said is that one is the biopsy which we need to do, and next for a staging purpose we need a PET scan. So PET scan, it visualizes the disease in the whole body, including the bones also. So what are the other sites which are involved? So if the disease is not involved in any other site, it's a curable disease. If it's involved in the other sites or if there are distant metastasis, so it's not a curable disease. So the intent of treatment becomes palliative for that. But yes, if it has not spread, which is very common in most of the patients, the disease is curable. So breast cancer, don't be feared of that, because breast cancer is one of those diseases which is curable in most of the patients. And the most important point being, it's a superficial organ, so we need to keep and watch. So the most stress is being given for awareness, because everyone needs to be self-breast examination.
The awareness first will start from self-breast examination.
So self-breast examination can start from any age. We don't have an age for that. But if you ask that what is the age at which a screening of breast should start, it's mostly for high-risk population. That means if the first-degree relative has a breast cancer
and there is a predisposition of BRCA1 and BRCA2.
In those patients, we need to start the screening from the age of 25. In other patients, we need to start the screening from the age of 35. So from the age of 35, the screening investigation of choice is a mammography at an interval of 2 to 3 years. And if it is at the age of 25,
that is a low-cost test.
And if it is at the age of 25 with a positive BRCA or a strong family history, an MRI of the breast may be done. Or in some circumstances,
it will be decided by you. The patient first will have to come to you.
For that, then only we decide. 1 or 2 points.
As because the most important thing you have earlier told that there is a measurement, there is a clinical measurement that you will have to find it.
Right.
Whether it will be benign or whether there is a chance of getting malignant.
Right. So the 1 or 2 points regarding the genetic testing, because genes are coming into the way in breast cancer in a big way. So nowadays any HER2 negative breast cancer is being tested with a germline BRCA1 and a BRCA test. That means the test is done from the blood.
That is readily available in Calcutta.
It is readily available in Calcutta, and we test most of the patients just to see.
And it is the protocol of the treatment.
It's the protocol of the treatment. So it is a germline test. That means the test is done in the blood. We need to test from the blood of the patient to see whether the patient is BRCA1 or 2 mutated, and if the patient comes out to be BRCA1 or 2 mutated, then our next generation, that means the son and the daughters and her sisters, also needs to be tested whether they also have that same BRCA1 or 2 mutation or not. If the if the kins have that, then they need to be cautious regarding the development of the malignancy in them, in the form of an ovarian malignancy or a breast malignancy. So that is the most important reason for doing a germline BRCA in the patients. And in patients, for the sake of patients, what we do, that if the patients are tested for a germline BRCA mutation positivity, they can be treated with a targeted therapy known as PARP inhibitors in the name of olaparib. That is the treatment of today.
That is a time-tested drug.
That is a time-tested drug which we use in such scenarios. So these are certain points which I wanted to make regarding breast cancer. The bottom line is that don't be feared of a breast lump. Remember that it's a superficial organ. It can be felt easily, it can be perceived easily. Go on and just go ahead with a self-breast examination, testing at a regular interval, preferably monthly at least, in each and every females at whatever age you want to begin with. And if you feel any lump in the breast, visit the doctor as soon as possible. Don't be panicked, because it may not be a malignant lump, it is mostly benign. So other symptoms which you might be feeling, it might affect your health also, are the pain in the breast or the discharge from the breast. So remember that all these symptoms are not a sine qua non of malignancy. They might be present in benign disease also. So don't be afraid, visit the doctor at the earliest. Remember, early breast cancer is the best one. So catching the disease early makes the life even much more longer, much more curable. So we need to catch the disease as early as possible.
So Tanmoy has vividly told everything regarding the breast cancer, and he has assured that mostly the patients coming to him are curable, as because they are hormone positive. That is 55 to 60% of the breast cancer patient. The remembering things are that you will have to keep in your mind self-breast examination first. If there is any anomaly, very first you would have to come to a doctor like Dr. Tanmoy Mandal, the medical oncologist. He will do everything on behalf of you and will peter out your cancer. Next Sunday we will meet at the same time. Hopefully we'll be better. Goodbye.
Goodbye.